and COVID-19 cases in Illinois have surged. Health officials say yesterday marked the 10th consecutive day in which the state has seen more than 10,000 new coronavirus cases. This data comes as Chicago Mayor Lori Lightfoot has issued a stay-at-home order that goes into effect today. And joining us now, Medical Director of Infection Control and an infectious disease physician at the University of Illinois Hospital and Health Sciences System, Dr. Susan Bleasdale, and pulmonary and critical care specialist at Northwestern Memorial Hospital in Illinois, Dr. Michelle Prickett. She has treated hundreds of COVID patients since the pandemic started. Dr. Bleasdale, I'll start with you. In terms of hospitalizations, are hospitals full to capacity, or is it the concern that they will become full to capacity?
Well, I think there's a difference right now in that we're seeing a dramatic increase in the number of COVID patients, but we're also maintaining our care for non-COVID patients. And so we are at critical capacity and will be quickly overwhelmed if we see an ongoing doubling of the rate of COVID cases that need hospitalization here.
So if it continues as these numbers are going, you're going to run into some trouble.
Yes. We're definitely seeing an increase in our beds.
Okay. Dr. Prickett, I think it's worth understanding where COVID stands right now in terms of people who do go into the hospital. Are more people going into the hospital and leaving and surviving COVID? Is there any hopeful news? And also, what about the vulnerability for those who end up on ventilators? What are the possibility for people who are vented? Is there more hope that they could get off the ventilator?
Sure, great question. The answer is yes, there is hope. We are very hopeful. We know our experience with the hundreds of patients we treated at Northwestern Memorial that we can get the vast majority of our patients through this condition if they get ventilated. 4 out of 5 of our patients that are on ventilators do come off, but it's a very long course, and it takes a lot of providers with a lot of expertise and a lot of years of training. And so the one concern we have is we can make as many beds as we want. We can't clone our providers to provide care to help patients through this.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.